Welcome to the PI interview. My name is Karin Klijn and I am here with Professor Craig Anderson, Dr. Lily Song, both from the George Institute, and Professor Yu from the Department of Neurosurgery of the Sichuan University in Chengdu. And we are here to discuss the results of the intensive care bundle with blood pressure reduction in acute cerebral hemorrhage trial, INTERACT 3. Dr. Song, can you tell us what was the rationale about your trial?
We all know the hematoma, intracerebral hematoma is the most serious but least treatable form of stroke. Before this study, no medical or surgery treatment had been proven to get level 1 evidence from the larger clinical trial. And even for the most promising treatment, blood pressure lowering, the evidence was controversial and the guideline recommendation is modest. So it might be because the treatment effect is not big enough, and so only a single treatment cannot improve the functional outcome. We therefore think maybe we can combine the management together, and maybe the combination of medical treatment can improve outcome.
Yeah.
And we also did some secondary analysis from INTERACT 2 trial, and we found a higher score assigned to baseline blood pressure, glucose, temperature, and prior to use of anticoagulation could independently predict the poor outcome.
Yeah.
So according to the above rationale, we designed INTERACT 3.
Yeah, thanks so much. Professor Anderson, so the intervention was a goal-directed care bundle. Can you explain us what exactly a care bundle is?
So a care bundle is a package of active management with particular goals, and so we had parameters around initiating the treatment as early as possible and achieving particular target parameters within a 1 hour period. And we worked with the various systems of care within hospitals to ensure that these parameters could be achieved. And most of this is around active nursing care and a more interactive engagement with the patients. So it's a package of care to streamline the management in all types of patients with acute intracerebral hemorrhage, as opposed to just applying blood pressure lowering or some other treatment in a selected manner. Now, there's a great temptation to want to try and unpack that care bundle and decide, well, was it this or was it that? But I think we've got to remember that we evaluated the whole system, the whole use of that care bundle. And so then there's the potential for the interaction, as Dr. Song has mentioned, a better treatment effect by combining these together, but also just applying a much more active process of management within the hospital system that made a big difference.
Yeah, I see. And before I go to Professor Yu, can you just repeat one more time what was the main result of the trial?
So when we implement the care bundle as part of a routine package in the hospital system for all patients presenting with intracerebral hemorrhage, there was a 14% relative improvement in their chances of having a poor outcome. That's that's dying or having severe disability. And we put that into a metric, which you may have heard of, number needed to treat, and our number needed to treat with 35, which is a very strong treatment effect for this package of care.
Yeah, which is an important achievement for all patients with ICH and also I think all over the world. And that gets me to you, Professor Yu. How do you think that the results of INTERACT 3 will impact on the neurosurgical clinical practice in China?
Okay, thank you. I think have a great of impact to China, because from this morning we published this paper. There are a lot of Chinese neurosurgeons and neurologists know this article, and they have a lot of discussion in China right now. So this, in fact, in China, it's beyond what I expected. But in future, I think there are some changes in China. The industry will bring to China. The first is some change of concept for the treatment of intracerebral hemorrhage. The concept, I think, the main change is from single factor, care of single factor, to care of bundle care, many factors, especially include our research, temperature, diabetes, blood pressure, etc. Many factors. This massive change of concept. The second is, I think, maybe change in China some guideline for diagnosis treatment of ICH. The last change, I think, I'm a neurosurgeon. Most of the time, I pay more attention to the surgery. In our signal analysis, there is a good functional outcome for surgery. So I think in the future, maybe I do more surgery, because the surgery for deep brain hematoma is controversial in the world in 10 or 20 years. In China, most of the time we do surgery for the big hematoma in deep brain, but no evidence for this surgery. In this secondary analysis, we get some evidence so that we have do the surgery briefly and it's legally, rationally. So I think in the future in China maybe do more surgery. I also hope the surgery treatment for the ICH patient can benefit for all the patient.
Well, Professor Yu, I wish I could talk with you longer about these important results, but I think we have to refer to the Lancet paper that is out, and we can read all the more details. And I'd like to end with thanking you for the great effort of including so many patients with ICH and making a difference for many patients around the world, I think, with the completion of this trial. Thank you so much.
Okay, thank you.
Thank you.